She then implemented a research program at the University of Washington to investigate human responses to outdoor spaces in cities using theory and methods of environmental psychology. Dr. Wu's mission is to discover, understand, and communicate human behavior and benefits as people experience nature in cities and towns. She was also research associate with the U.S. Forest Service Pacific Northwest Research Station, collaborating on studies of social dimensions of urban forestry and ecosystems. Kathy is committed to science translation and outreach and actively shares research at www.naturewithin.info and the Green Cities Good Health Project at www.greenhealth.washington.edu. These links will be posted in the chat box. Without further ado, please take it away, Kathy.
Jan, thanks so much for the introduction. And it's my pleasure to be sharing some information, some research, some evidence about nature and health. And I understand that that has been a theme of the conference, of the sessions earlier today. And I'm going to jump immediately into some slides. Dr. Hollis started out this session this morning with the thoughts about nature, the internet of nature. And what I took away from a little bit of background reading about her work is the question of scale. So in urban planning, strategic planning, regional planning, we often think and work at different scales. And so I see, to my limited understanding of Dr. Hollis' work, is we are working at a little different scale. She is looking at the meta level, if you will, or the macro scale, where my work tends to look at the micro scale, the experiences that people have within the green spaces, within the nature that is detectable by remote sensing and by large scale imaging systems. So what I'd like to talk about in the next 45 minutes or so is, first of all, some of the work that we've done to understand trees and health, city trees and health, human health. Not only my own research, but research has been happening around North America, if not the entire world. And then there are so many facets of health response to nature that in this short time, I've chosen to do a little deeper dive on the details of mental health, because that is a concern that has really popped up of late. It's been an undercurrent. It's been a public health concern for some time, but with COVID, that has been elevated. So I'd like to speak to that a little bit more. And then finally, I'll wrap this up with economic value. As we have this abundant evidence of nature and health response for people in cities, in towns, in urbanized settings, what might be the economic value and economic consequence of this understanding of this relationship, this particular relationship with nature? So let me start with a project that we published just a couple of years ago, a collaborative team, group of people representing various institutions of Canada, as well as the United States, myself, and some representation from the Forest Service. We did an academic review of research, and this is fairly standard in academia, in research scholarship, is people are doing various studies of smaller questions or hypotheses, and then someone decides, or a team decides, to assemble this information, look for the patterns of response, and that's what we did with a focus on trees and human health. And so this process that we did here, represented here again, is fairly typical. You do a broadcast across various science databases using keywords, and this turned up thousands of articles. You then typically have some rules or guidelines for how to select the articles, how to winnow down that collection, which took us to about 400 articles. We also applied a science quality assessment, and I won't go into detail here, but it has to do with the quality of the hypothesis, the quality of the statistics, and how the research was conducted. So that took us to about 200 articles. And I'll mention that these 200 articles are but a subset, again, the focus on trees and health, of thousands of articles, literally thousands of articles having to do with nearby nature and cities and human health response. And a representation of that work, that broader work, is the website Green Cities Good Health, which Jan mentioned, and hopefully the link will be in the chat. If it doesn't appear there while I'm speaking, I'll try to get to that at the end of this talk. So we looked at these articles and we saw a lot of detail. And by the way, that article, if you search City Trees and Health, and my name and another author, Barron, for instance, there's no paywall. The article is downloadable for free. But as we look, there's lots of detail in the article, of course. But here are some high-level patterns we saw. First of all, you see in these articles that having trees in our surroundings, around our homes, offices, schools, and so on, promote general wellness. So we may feel fine or fine enough, and having trees promotes general wellness, so stress reduction, better mood, promoting physical activity, which I'll talk a little bit about more later. But if we're clinically diagnosed by a hospital or a caregiver, healthcare worker, a particular disease or disorder, there are a number of them where having trees around us provide therapy and treatment. And sometimes that might be prescribed, prescription by a healthcare provider, or it may be something that we learn about and we incorporate into our own lives, recognizing a particular diagnosis. Another high level understanding from this review is that trees, the urban forest, is a social determinant of health. And what do I mean by that? If you encounter, talk with, discuss things with a public health official, they are now speaking quite a bit about the social determinants of health. And it reflects then this particular definition of health. It's a state of complete physical, mental, and social well-being, not just the absence of disease. And we understand that there are many factors, many aspects of our lives and our everyday physical built environment that influence our health. And so while key decisions, personal decisions we make about exercise or what water we have access to or the quality of our food, those are important. Yes, those individual decisions, but there's so many other things that are influences on our health and may have even more impact on those personal decisions, such as access to good health care, such as education opportunities, such as work opportunities, such as the quality of our homes. But outside this circle, and maybe that's the internet of nature, is the natural environment, the character and access to the natural environment, which of course includes urban forestry and city trees. Another high level sort of message from this research is dosage. That the earliest research was something measurable about green, about nature, something measurable about a health outcome, statistical correlation, and finding a relationship. But with ever more refinement of the science questions, we're seeing studies about dosage. And generally, though there are various findings, but they do kind of converge on 20 to 30 minutes for a nature encounter experience. And this can be just out your door, down the street, nearby park, doesn't have to be far away beyond the city, 20 to 30 minutes or 120 minutes a week. And this is really interesting in that it coincides with the CDC's recommendations for physical activity of about 150 minutes a week of moderate activity for adults. So here we see if you're doing this activity, perhaps doing it outdoors with the extra layering of health benefit potential from those encounters with nature. Another topic, high level topic that we see across these studies is attention to diversity and equity. And as you well know, Maybe some of your communities have done these analyses. They've happened in many places across the country, that there is varied distribution, disparities in distribution of trees and parks across communities, with often underserved or lower income communities not having as much green. And until recently, with all the research about ecosystem services and public health and so on, it was like, trees and parks, they're pretty, they're nice to have. What's the big deal? They don't have them, we do. You know, now we know that nature, nearby nature in every community is profoundly, profoundly important. And so what we're seeing is ever greater attention to understanding those disparities, their geography, their root causes, the historical causes, and then addressing that through focus programs, concentrated programs that not only say, well, we're going to plant trees there or create a new park, but engagement with the community so that there's cultural expressions, there's symbol, there's room, place for celebrations and so on. And again, this understanding of the disparity, this, for example, is one representation done by analysis done for the Center for American Progress, their nature gap analysis. Really interesting website if you'd like to learn more about this, because not only have they done this analysis on a national level, but they have also done it on a state level. So if you'd like to look at this, perhaps representing Maryland or the other states that you may be from here attending. But here you see percent of people living in a nature deprived area by census tract demographics. And they did those comparisons not only on the national scale, but also at the state level median. So there's a local, a mid-scale localization of this data analysis. And here you see white people less likely to be in nature deprived areas than people of color, people of other background, even indigenous people. And here is another representation of that. Again, by income, not by ethnic background, although that last bar is, but also by income level. And perhaps less correlation by income level other than the lowest income compared to people of color representation. Another, an opportunity, high-level opportunity that we see from all of this is, and I'm seeing this emerging across communities as I speak to people about urban forestry planning and management, is interesting new partnerships. So the first and obvious is the healthcare and public health communities, professionals, and so on. And Parks Prescription is one response to that. Walk with a Dog. There are other more local programs where healthcare organizations are incorporating more healing gardens, or they're actually working with communities to increase adjacent greening and so on. Schools, I'm working on a research project with the Trust for Public Land, where transformation of schoolyards to community parks. And there's an obvious partnership because schools often have large land holdings that are underutilized and can be encouraged and transformed to be more green spaces. Civic organizations are starting to pay attention to this. Rotary, Lions, and so on. I recently heard about a project in one of my communities here in the Seattle area where the VFW, Veterans of Foreign Wars chapter, was collaborating with the community on a tree planting program. So we're seeing lots of uptake of nature and health by organizations that traditionally would not have paid much attention to this, because again, there's this residual attitude of, well, trees and parks, they're pretty, they're nice, but now organizations are starting to see nature and health as part of their mission. So again, the scoping review available, there you see the citation, and it is free for download if you'd like to take a look at it. A little more information there. Across the 200 articles, there were various themes of findings in addition to these high-level messages that I just spoke about. and one is mental health. And I would say that not only in the trees and health, but nature, nearby nature, literature more generally, mental health is some of the more robust research. I observe at least a greater quantity of that research and a variety of research method applied to it, and perhaps greater consistency of findings. And this is really important because COVID has for people of all ages, from school children to adults who have been multitasking to the max, being at home and everything that's going on. Healthcare workers, my daughter has been working in a hospital through the COVID era, and mental wellness has been, our family, we've attempted to support her in that, even though we live far away from where her work is. And for me, Chesapeake Bay in your area, here in Washington State, Puget Sound, I live on an island. I have quick access to the waterfront or to the shore. And some friends and I, we started kayaking immediately when we heard about COVID. We knew this was not going to be a short haul for us all. And and day trips, go out once in a while overnight, but day trips through the afternoon. And in July, we racked up a total of 1,000 miles. It was kind of a surprise to us, but it's been, for me, a really important mental health response. And in that, there's some shorelines that are highly built up, but there's some that are a little more remote feeling, private property. Some of them are public lands that are not accessible by roads. And the trees, oh my gosh, some of these old gnarly trees like this Pacific madrone that, there are times where I just tell my kayak friends, yeah, just keep going, I'll catch up with you. And I just had to marvel at some of these trees that are scattered along the Salish Sea. And again, a mental health response, seeing these trees, experiencing that, really an experience I would look forward to every week as the weekend would approach. We're also hearing in the news and maybe experiencing directly climate events, heat, summer heat, wildfire. I've been interacting with a group in Iowa that's attempting to recover from derecho, thousands of trees lost in a very short burst of extreme wind. Flooding, we're hearing about different places, and of course, typhoons and hurricanes. And there's a term in psychology for our response. Of course, there's the response of risk to our homes and loved ones, our pets. But there's also, if we're at a distance from these events, solastalgia. Solastalgia is this existential or emotional distress that we feel. It's almost a form of grieving from environmental change. And so that's another mental health challenge that many people are facing. So let me now dive into more detail, very fine scale, of nature and mental health response. Again, that's not to say there are not other dimensions of health, such as physical health, such as social cohesion and social capital. There are a number of other elements that contribute to self-care and community care, but because of the limited time I have, and because of the urgency of mental health concerns, this is where I'll go for the next few minutes. Another high-level message related to mental health is we saw across this research that having trees in our communities benefits people at all stages in the human life cycle, cradle to grave, from the very earliest hours and days of our lives to the very end. And this is important in thinking about planning urban forests, who lives there, what are their needs, access, and so on. But this is another story we can tell about the importance of trees. Is no matter what your age, no matter what your economic situation, whatever your cultural background, trees are important in your lives to have them. Here, for instance, on the left side is the cradle end of things, and you probably have heard about the studies. And now, it started with one, Jeff Donovan in Portland, Oregon. Now these have been done around the world, but finding that women who are pregnant and have nearby nature within a certain buffer distance, their babies perhaps better birth weight. Across entire city populations, you see the incidence of better birth weight. And now studies are starting to look at the health of the woman during the pregnancy period and the influence of having green. Later life, we see in elder care facilities benefit of having healing gardens, wander gardens, having nearby trees, and so on. And as we age, mobility is really important. You got to stay active. You got to keep moving, maintain flexibility. And having those green spaces outside our homes or outside our care facilities are those places where we may be more inclined to walk, move around, maintain that mobility. So I'm now going to span really quickly a selection of studies. This is not the full extent of it, but just a representation of this idea of cradle to grave. And we start with children at a very young age, and they are building up from the day they're born. They're starting to build up this microbiome in their GI tract. And we hear about probiotics, eating yogurt, eating other foods, but frankly, as one ecologist calls them, old friends. That is the microorganisms that are in our nature environments, and contact with them. We accidentally ingest them. They're on our hands, they're around us, we take them in, and it helps to encourage a better microbiome. And we see then the long-term consequences. It may have to do with behaviors or physiological responses that affect obesity, asthma, boosting immune function, better mental health. The gut and brain are remarkably connected. More and more knowledge about that is coming along. So eating dirt, that might not be the solution, but having access, children access, contact to safe outdoor environments, right? You don't want soils that are contaminated and such. But eating produce immediately out of a garden, there's, inevitably you get some of that grit and soil in there, and it's a part of building this microbiome. ADHD. So this is one of those situations where there's a clinical diagnosis. Might ADHD be alleviated, not removed or not eliminated, but perhaps helps then to reduce the amount of meds that are typically prescribed for ADHD. But in this study, a classic done by Ming Kuo and her colleagues some time ago, and they looked at routine activity, 20 minutes, there you go, that 20-minute dosage in a park, in a more built neighborhood, in a highly built downtown area, finding that recovery, better cognitive performance associated with the park experience. And there are a number of organizations. I understand that one of the earlier presentations today was about forest schools. So you probably learned a great deal about those, and they're highly popular here in the Pacific Northwest. Long waiting lists, pre-kindergarten, children are outdoors as much as possible, and a range of curriculum goals, social learning, creativity, teamwork, as well as some of the academic preparation, getting ready for more formal schooling. Wonderful places, and with more and more research overlay, so we understand perhaps how to better serve the children and how to further develop curriculum. And you may know of the Children in Nature Network, Richard Louve's book, Last Child in the Woods. He and friends and colleagues launched this website, and there's an annual conference, but the website is a wonderful resource for anything really, any topic, any program. There's a lot of program examples as well as research, and wonderful infographics that have been translated from the research. So it's a good resource if you're working with children or schools. High school campuses, children get older, they continue to appear to benefit from having green in their learning, in and around their learning environment. Randy Matsuoka did this study across multiple high schools in the upper Midwest, and finding that simply having window views, and some of these studies are about window views, some of them are about the landscape character of the campus itself, others are about surrounding vegetation. But in this case, finding better test scores, graduation rates, fewer occurrences of criminal behavior. I have to dig into what that means, but often the interpretation of behavior tipping into criminal, that's become a hot topic and of concern. All that aside, I digress, right? All that said, there appears to be academic performance benefit of having nature in the campus and around the campus environment. All right, we become older, move into adulthood. I mentioned this very briefly. Physical activity, so important for so many things. Obesity management, diabetes management, cardiovascular health. It's just really social cohesion. If you're out routinely moving about, you see people, you become familiar, get to know them, you start to develop a sense of your community and maybe even move then to more formal relationships and how people can work together. But physical activity outdoors, this is a review, and they found that equivalent physical activity that was done outdoors, there was more benefit associated with that as compared to doing the same activity indoors. Greater feelings of revitalization, increased energy, more decrease in tension, confusion, anger, so on, the emotional side. But what's interesting here is greater satisfaction and as stated, more likely to repeat the activity. And that's what's really important about physical activity, is that it's routine, it's a part of your life. And here you see perhaps greater motivation to continue that activity when you are inclined to do it outdoors. A response in many communities, and some of you are parks professionals, walking programs, so basic, but so important in our communities. And what I've read in the research is that offering a walking program sometimes welcomes people to a place that they're either unfamiliar with or they're not sure if they belong there. So here is an introduction, a possibility of an introduction to your park or natural area in a way that tells people, here are our facilities. There's these great trails. We have restrooms, there's water fountains and so on. Come and share this with us. And some of the programs are oriented, they might be general all-call, or they might be oriented more to children, more to elders, more to families. They might have themes such as, natural history learning, or, and there are other things, of course, yoga in the park and whatnot. But that is this connection of nature and physical activity. Physical activity is very, very important, but doing it within the surrounds of nature adds another layer of benefit. Walking meetings, this is another opportunity, more in the workplace perhaps. And you see a different dynamic when you're walking with someone and carrying on a conversation or discussing a project. It's quite different from sitting in the room around the conference table or at a desk. I occasionally do this with students and find it to be very productive. Walking, though, really important. Got to get out of the car, right? You actually have to walk, not just the dog. All right. Physical activity promotes wellness. On that other side, remember healing and therapy, that other dimension of the value of nature and health, mental health, depression reduction. So in this study, Mark Berman at the University of Chicago gathered a group of people who are depressed, diagnosed with depression, and ran this experiment. And so half the group, randomly assigned, half the group walked in the red line, less green, other half walked in the green area, more green. What you see is if you don't repeat nature experiences, you see a diminished effect over time. And so he waited several weeks, invited the group back, and they flipped. And that's a really cool experimental approach, because then you control for the individual traits of people, their economic circumstances, and so forth. It's the same group doing the two different treatments. And what he found, cognitive and affective benefits, increase in memory span and capacity, increase in mood. And he found in doing other similar studies that the effect size for those who are clinically depressed is much greater than for people who are healthy. So there's something to remember too. Another high level message is if your baseline in terms of health and less access to green, if that baseline is fairly low, adding green offers more or generally generates greater benefit than if you're at a high baseline and you add an equivalent amount of green. You just don't see as much change in people. So low baseline can be the place, the situation that could be targeted for more greening in order to generate greater level of health benefit. Forest therapy and forest bathing. This has taken off, and no doubt some of you have incorporated this. Maybe you have become forest therapy guides, or you've incorporated it into your parks and open space systems. When I first started talking about this, and it wasn't that long ago, let's say 5 years, 7 years, the response from audiences was kind of like, whoa, that's kind of woo-woo, Kathy. Now, totally taken up, right? There are professional guides who offer these experiences. They're being incorporated into healthcare systems in some instances. They're being incorporated into parks departments, incorporated into business situations, and so on. And what is it? It is not a run in the forest. It is not walking about with your device and using it as time to catch up on text and email. It's slow. It is slow movement. It is mindfulness. It's intentional. It's opening up your senses. And one can do this, learn a little bit about it. One can do this on your own, but I highly recommend doing this with a guide, because there's a sequence of experience that takes you ever deeper or ever more away from all the distractions of our lives for the benefit of being in that environment. And this is supported by extensive research. It was started in Japan, South Korea, and is now being done all around the world. And this recent review pointed out all sorts of benefits. I'm not going to read the list. You can see it. You've probably heard about a lot of these. Everything from improved cardiovascular health to that last one there, the natural killer cells, which is, these are cells that are part of our immune system that may respond to initial incidence of cancer. And it appears that there may be a boost in this system due to phytoncides that are emitted by trees and taken in. Lot more to learn about that, but some really interesting preliminary findings. And of course, the guides, here is one organization, national organization, actually international. They do trainings now, a combination of remote and on site. And here we see, this is where, if you're interested, pursue more information about becoming a certified guide. Mental wellness and function, all ages. So I've talked a little bit about some of the treatment and therapy potential of trees, but we're in a place now, in part because of COVID, but because of modern lifestyles, which are very task-oriented. You have to spend a good bit of time focused on a screen, focused on a project, focused on a budget, focused on a report. And this, humans, we did not evolve to do this. We do it, but what happens is cognitive fatigue. We just, this demand of very intentional focus can really deplete our ability to process information effectively, to respond to these needs and activities. And a longstanding theory about this from Rachel and Stephen Kaplan is attention restoration theory. And what they discovered in their research, their colleagues and students continue to understand this, is with attention depletion, we can be more frustrated. I don't know if you've felt that. There's sometimes where I've been working for a while on a project and I'll look at the screen and nothing's happening anymore, or the quality of it really is sacrificed. So we then experience frustration. We may become more impulsive. That is impulse control or impulse management may be diminished. So maybe our choices aren't so good. And we've even seen increased aggression associated with this. So nature offers respite for this and the opportunity to recharge. And there's some characteristics of places then that offer this opportunity. And they don't have to be far away. Again, they can be quite close to where we are, where we're working, where we're studying, where we're trying to carry on a very busy, complex life. The idea of being away in a sense of remove yourself from that attention demand situation, not meaning traveling great distances. Extent that there's enough room to say, do a little bit of physical activity, to move about a bit, and that it's compatible, that you feel safe, that the surfaces, the walking surfaces are safe, and so on. But soft fascination is the key here. And that is enough, there's enough that draws your attention without effort. So, you know, it might be flowers, it might be foliage textures, it might be wind through the tree, water just holds our attention so readily. So this idea of soft fascination really helps with attention restoration. And of late, some ecologists are collaborating on these studies, and biodiversity may be an element, or probably is an element in this soft fascination. In this one study, they used proxies of vegetation cover and bird abundance to explore how people responded in terms of mental health. They found reduced depression, reduced anxiety, reduced stress. But look at those numbers, 20% cover, 30%, 20% cover. Might that be the another support for canopy cover rates? And that's what I'm seeing also in this research, is some convergence between the percent of vegetation, naturalness, whatever it's called. And again, the internet of nature might play into this. So the percent of vegetation expression, and then health response, which gives us yet another validation for canopy cover rate goals. And Cecil Canindike has formalized this a little bit. He just published an article, I think it was last week, in the Journal of Forestry Research about the 3-30-300 rule. And he has had urban planners, you know, request of him, hey, what do we do? You know, how do we incorporate trees in cities? And he is taking this to the most basic understanding, 3-30-300. Every person should have a view of 3 trees from their home, 30% canopy cover, 300 yards to a park or open space. Very basic, rather ambitious, but it sets a standard. It sets a point of discussion and potential planning opportunity. All right, my interpretive takeaway over time of all of this, I'm ending now the mental health, the more detailed dive into some of the specific studies. But what I see across all of this is having nearby nature is not unlike nutrition. We may have the memorable feast, Thanksgiving, a celebration, whatever, where a lot of people come together, enjoy special foods, enjoy each other's company. Hopefully you enjoy each other's company. And to me, my daughter lives in Alaska, and she has taken our family on some incredible outdoor adventures. Those are memorable feasts in a nature experience for me. A nice meal at a restaurant, that's another part of our food intake. And you know, the nature equivalent is maybe going to a nice regional park for a day, or for me, the full day Saturday kayak. Okay, but we need everyday good nutrition, everyday meals, whatever your pattern is, 3 squares or other ways of gaining the nutrients, the vitamins, the energy materials that you need. We need nutritious meals on a daily basis. And I think now the same about nearby nature, that everyone needs high quality, readily accessible nature on a daily basis. And it may be viewing, it may be passive, looking out the window, short walk, or it may be more active, longer walks, cycling, getting that 150 minutes a week of moderate activity. But we need quality nature around us, again, for that daily intake. All right, here we go. Pivot now to economic value. What are the consequences economically of what we've learned from this research review about trees and nature and health, including the focus on mental health? And I must say that this hasn't moved along in the research literature as quickly as I would have thought, because it's difficult to calculate these numbers. But it's so important because these are the most current statistics on our healthcare spending in the United States. And so per capita in 2020, you see in Maryland in the United States in 2014, I was not able to find more current state level spending, but I would guess last year, again, COVID, right? But last year, actually the year prior, healthcare spending increased 10%, 10% in 1 year. So I imagine those 2014 numbers are probably pretty close to what you see for the 2020 there. This represents almost 20% of our gross domestic product. So I often hear, well, you know, Kathy, great, nature and health, you know, but and trees and health, but how do we pay for it? If we can somehow siphon off from healthcare, I know this is, you know, kind of pie in the sky, but if we can demonstrate the value of trees and possible impact on healthcare budgeting, maybe that's where there are some funds available for planning and management for trees. It's a challenge, I know, because they're so pulled apart as fiscal systems that intersection is it's not easy to propose nor defend, but I'm starting to see a glimmer of this happening. And where are the costs for healthcare going? Well, they're ongoing diseases. They're diseases that are not taken care of with one round of antibiotics or one trip to the doctor's office. These are chronic diseases that may be with a person for years and thus require treatment, meds, and so on. So again, if nature is a motivation for healthy lifestyles or facilitates healthy lifestyles in a way that can diminish these chronic diseases, there's potential healthcare savings across society. Well, how do we calculate these healthcare costs? So, you know, this is not too far out of the realm of resource economics. For instance, here, the Nature Conservancy has summarized the various benefits that are modeled by, you know, different sources, including iTree, so stormwater management, biodiversity, cooling, energy use, and so on. And so what happens with those various benefits, and again, this is but one model, iTree offers this opportunity, is deferred or avoided costs are really at the core of much of this. So for instance, stormwater runoff, if you're reducing the volume of water that's entering the pipe, the drain and pipe system, that may preclude having to upgrade at very great expense that stormwater management system. And thus one can calculate then those avoided costs. Well, the same can be done for healthcare. And I've done a little bit of work on this, not of late, but this analysis process is really quite complex. So first of all, you find the evidence. Again, this is not unlike the ecosystem services or the biophysical services. You look for the evidence of an outcome, a beneficial outcome. In this case, though, with health, you also look at the nature experience and the beneficiaries. And that's what complicates this a little bit, because it's not simply the evidence of benefit and the health response. You do have to consider any concentration of particular beneficiaries in an area and the type of nature experience they're having. But you can then move that to evaluation, again, with primarily that being deferred or avoided costs. If you're not having to seek as much counseling for mental health, if you're not having to seek medications for various chronic disease and so on. Those are avoided costs that may be a few dollars here and there for people, but if you tally all that up across a city, a state, a nation, it does become substantial. And some examples of that. So did a little bit of work with some resource economists a few years ago. And if you Google this title, Nature Conservancy, Nature's Riches, there's a spread here that talks about these opportunities, some of them with actual numbers, dollar values, and others with prospect. If that's the thing, the research in nature and health is so disparate, and people are not thinking about, when they do the research, they don't think about, could this be translated to economics? So finding the shared methodologies for moving to economic valuation, it's difficult to do that because it's not an intention as people are developing their studies. Anyway, across the nature's riches, this is what we found. And this is but a sampling, of course, of nature and health benefit. But we found a range of from 3-ish billion to 7-ish billion on an annual basis for the entire United States. And again, these are numbers some time ago, 2015. So no doubt those are elevated now due to inflation and increased healthcare costs. But there's promise in this research. Here's one study, total area greenness and Medicare spending. So this is kind of the Internet of Nature scale, is looking at remote sensing expression of greenness, and then geolocating Medicare patients and looking at the possible impact on that spending. Then here is one of the more interesting studies that have come out just recently, just in a matter of months. One of the largest healthcare insurers in Northern California actually offered access to patient records. And it was quite a wrestling match because they had to anonymize the patient's locations. They'd remove all identity information, right? But you have the households, you have the green remote sensing. And what they found was people who have the most green had reduced healthcare costs of about $300, $400 a year. That's substantial. Again, if we roll this up to an entire state, entire nation, but what's important here is that level of greening. So perhaps we can make the case for increased investment in nature based on this potential healthcare savings. All right, wrapping this up. It was a very quick overview. I hope you found some interesting messages that you might share, some interesting data that you might share. And I'm guessing that, well, the recording is available, but the PowerPoint, if people would like access to the slide stack, that's fine too. But what we see is city trees in our review. They promote well-being, but they're also useful for therapy situations. And trees, the urban forest, nearby nature, it's a social determinant of health, which is a prominent notion or a prominent topic now in public health. And there's life course benefit. Everyone of every age, it's important to have access to green. Mental health benefits are prominent now in public health, and people are paying more attention to that. We have to, because we're seeing mental health decline in the post-COVID times. Economic value, there's so much more to learn. And I've approached economists, some of them public health economists, and they're like, oh, I don't do nature. And then I've approached natural resource economists, and they're like, well, I really don't do people and health. So finding this meld where it's starting to happen, and it's encouraging the numbers that are coming out of it, but we have so much more to learn.